Did you know that some men in their 60s, 70s, even 80s are having stronger, longer-lasting erections today than they did in their 40s? And no, they're not popping pills or going under the knife. They've tapped into a little-known, often overlooked muscle that holds the power to restore control, rebuild confidence, and reignite intimacy. The truth is, if you're a man over 60 and you're struggling with dribbling after you pee, trouble getting or maintaining an erection, or even finishing too fast, you're not alone. But you're also not stuck. There's something you can do about it, starting today. I'm Dr. Mohit Kara. I've spent over 30 years in men's health, working side by side with aging veterans, retired professionals, husbands, and fathers. I've helped thousands of men just like you reclaim the strength they thought was gone for good. And what I'm about to show you could be the missing piece you've been looking for. Because here's the surprising truth. Most men assume their issues are all about blood flow or testosterone. But for many, the real issue lies deeper, beneath the surface, in a weakening pelvic floor. And the fix doesn't involve prescriptions. It involves practice. Just a few focused minutes a day can create real, lasting change. In this video, I'm going to teach you exactly how to perform Kegel exercises the right way. Not only will it help you last longer in bed and strengthen your erections, but it will also improve your bladder control and may even make your orgasms feel more intense. And if you think you already know how to do a Kegel, you'll want to stick around, because most men are doing it wrong, and that one mistake could be holding you back from real results. Before we begin, if you haven't already, I encourage you to subscribe and turn on the notification bell, so you won't miss any future tips designed specifically to help men over 60 take back control of their health. And if this message resonates with you, type 1 in the comments. If not, type 0. Your feedback helps me make this content even better for you. Now that you're here and ready to take action, let's start with the foundation. Understanding exactly what Kegel exercises are and why they matter so much for men, especially as we age. Because before you can do them right, you need to know what you're actually working, and how this one group of muscles can quietly hold the key to better erections, improved control, and renewed confidence. 1. What are Kegel exercises for men? When most men hear the term Kegel exercises, they either think it's something for women or something that doesn't apply to them. I used to hear it all the time in my office. Men would smile awkwardly or even roll their eyes, and I get it. The idea that a simple, invisible exercise could impact something as deeply personal as your ability to perform in bed or control your bladder seems, well, a bit too good to be true. But let me tell you this. Not only are Kegels very real for men, they are often the missing piece that no one's ever told you about. Kegel exercises are all about strengthening your pelvic floor muscles. These are a group of deep muscles that sit at the base of your pelvis, stretching from your tailbone in the back to your pubic bone in the front. You can't see them, but you use them every day. When you go to the bathroom, when you stop yourself from passing gas, and yes, when you're sexually active. In fact, these muscles play a central role in erections, ejaculation, and overall sexual control. They support your prostate, bladder, and rectum, and they're part of your core, helping to keep everything stable and functioning smoothly. As we get older, these muscles naturally weaken. It doesn't mean there's something wrong with you, it's just part of the aging process. But that weakening can lead to symptoms that most men chalk up to getting old, when in reality, they're often signs of a deteriorating pelvic floor. Maybe you've noticed a little leak when you cough or laugh, or that slow dribble after you think you've finished urinating. Maybe it takes longer to get or stay hard, or you finish sooner than you'd like. These are the things men tell me behind closed doors. They whisper them. They wait until the end of the appointment. But these concerns are more common than you think, and they're nothing to be ashamed of. What matters is what you do next. The beauty of Kegel exercises is that they target the root cause of many of these problems, weak pelvic floor muscles, and they do it in a natural, drug-free way. When these muscles are strong, they act like a foundation, holding everything in place and helping your body respond the way it's meant to. When they're weak, the systems they support begin to falter. And the best part? You can strengthen them at any age. I've seen men in their 70s and 80s start doing Kegels and, within a few months, tell me they're no longer waking up 5 times a night to urinate. I've had patients tear up because, for the first time in years, they felt like men again, whole, capable, and in control. One of the most powerful stories I remember came from a retired Marine in his late 60s. He had undergone prostate surgery and was struggling with leakage and intimacy issues. He was frustrated. Embarrassed. He didn't want to be intimate with his wife anymore because he didn't feel like himself. When I introduced him to Kegel exercises, he was skeptical, but he gave it a shot. He practiced daily, even when it felt silly or pointless at first. And after 3 months, he came back into my office smiling. He said, "Doc, I feel like I got a part of my life back I thought was gone forever." That's the kind of change we're talking about here. Real results, real hope. Understanding what Kegel exercises are is the first step, but it's only the beginning. Knowing what these muscles do is one thing, but how do you actually find them? How can you tell if you're doing the exercise correctly, especially when you can't see or feel those muscles the way you would a bicep or a leg muscle? Well, that's where things get interesting, because next, I'm going to show you exactly how to find the right muscle, and the one simple test that tells you if you're activating it the right way. Don't skip this part. If you get this step wrong, the rest won't work. Let's dive in. 2. Science-backed benefits for men over 60. I'll be honest with you, when I first started recommending Kegel exercises to older male patients years ago, not everyone took it seriously. Some would chuckle. Others would politely nod and never follow through. And I don't blame them. It's hard to believe that such a simple, invisible practice, just squeezing muscles you barely even knew existed, could have a measurable impact on something as serious and frustrating as erectile dysfunction or urinary leakage. But over time, the research kept building, and so did the stories from my patients. And what started as a quiet recommendation has now become one of the most powerful tools in my men's health toolbox. Let me walk you through what the science actually says, because once you understand the facts, you'll realize this isn't just some vague wellness trend, it's real, measurable medicine. Back in 2005, there was a randomized controlled trial, what we in medicine call the gold standard of studies. It involved men suffering from erectile dysfunction. One group received standard lifestyle advice, like quitting smoking and exercising more. The other group received the same advice, but also began a regimen of pelvic floor exercises, guided by biofeedback tools that measured their muscle strength. The results were striking. After just 3 months, the group doing pelvic floor training showed significantly better erectile function compared to the control group. And even more impressively, at the 6-month mark, nearly 40% of those men had regained what doctors classified as normal function. No pills, no pumps, just daily, consistent practice. And the research doesn't stop there. A 2019 systematic review looked at 10 studies focused on pelvic floor training for men and found similar outcomes. Across the board, men experienced improvement in both erectile function and premature ejaculation. In one study, ejaculation time increased from a mere 39 seconds to over 2 minutes, just from strengthening the pelvic floor. I can't tell you how many patients have told me they thought that kind of improvement was impossible without medication, but it's not. It just takes effort, and most of all, belief in your body's ability to change, even in your 60s, 70s, and beyond. Another crucial benefit that's often overlooked is the impact on urinary control. This becomes especially important for men who've undergone prostate surgery. After a prostatectomy, it's not uncommon for men to experience leakage when coughing, sneezing, or lifting. Kegels can significantly reduce these incidents. In fact, studies have shown that men who begin pelvic floor exercises before and after surgery tend to recover continence faster and more completely than those who don't. But numbers and percentages only tell part of the story. What really stays with me are the men who come back into my office with their shoulders a little straighter, their voices a little stronger. One man in particular, a retired firefighter in his early 70s, had been quietly dealing with embarrassing leaks and struggling with intimacy. He was skeptical, but he was also tired of living in fear of every sneeze or every intimate moment. 3 months after committing to Kegels, he told me his life felt steadier. That was the word he used. Not just physically, but emotionally. He was no longer worried about accidents, and in the bedroom, he said things felt alive again. That kind of progress doesn't just affect your body, it touches your identity. There's even some emerging evidence, though still early, that suggests stronger pelvic floor muscles may intensify orgasmic sensations. That's right. Doing these exercises might not just help you function better, it might actually help you enjoy those moments more deeply. And at this stage in life, when we're looking for more quality in our experiences, not just quantity, that matters. So let's recap. Stronger erections, improved bladder control, delayed ejaculation, and potentially deeper pleasure, all backed by real science and real stories. That's the power of consistent Kegel practice. But before you jump in, there's one thing we need to get absolutely clear. Doing the exercises wrong can do more harm than good. So how do you find the right muscle and know you're doing it correctly from the very first try? That's what we're about to uncover next. And trust me, it's the step most men miss. 3. Who should not do Kegels? One of the hardest parts of my job isn't treating complex cases or keeping up with new research. It's having to tell someone who's finally motivated to take control of their health that they need to slow down. And that moment comes up more often than you might think when it comes to Kegel exercises. Because while Kegels are safe and incredibly effective for most men, there are some cases where jumping into them too quickly or without proper guidance can actually make things worse. And if you're over 60, it's especially important to get this right. Over the years, I've sat across from men who were doing everything they could to feel better. They'd heard about Kegels, maybe read something online, and started on their own. But instead of improving, they noticed increased discomfort, new kinds of pressure, or even more urinary urgency. And it wasn't because they lacked effort or discipline. It was because no one had told them what I'm about to tell you now. Kegels are not for everyone, not at first. If you have what's called pelvic floor dysfunction, Kegels can actually aggravate your symptoms. This is a condition where the pelvic floor muscles are not just weak, they may be too tight, overly tense, or simply not coordinating properly with the rest of your body. For men with this issue, adding more tension to an already dysfunctional system is like trying to tighten a screw that's already stripped. It won't hold, and it may create more damage. So how do you know if you're in this group? There are a few key signs. If you have chronic pelvic or genital pain, especially pain that gets worse when sitting, that's a red flag. If you experience pain during erection, ejaculation, or orgasm, that may indicate a hypertonic pelvic floor, which means the muscles are stuck in a state of tension. If you deal with frequent or urgent urination or chronic constipation that hasn't responded to diet or hydration changes, you might be dealing with a coordination issue rather than weakness. I once had a patient, let's call him Jim, a 67-year-old man who came in with severe discomfort in his lower pelvis. He'd been following a Kegel routine he found online, convinced that it would help his leakage and intimacy issues. But what he didn't know was that his pain was actually a symptom of muscle overactivity, not underactivity. When we did a proper pelvic exam, it became clear that he needed to release those muscles, not tighten them. With the right physical therapy and breathing techniques, Jim finally got relief, but not from more Kegels. He actually needed to back off them completely. And that's something every man deserves to know before starting. There's another group of men who should hold off. Those who have recently undergone surgery, particularly prostate surgery, or who are currently dealing with a urinary tract infection. After a procedure, your body is in recovery mode. The tissues are healing, and adding the extra strain of pelvic floor contractions too soon can slow that process down. Similarly, an active infection in the urinary tract can lead to inflammation and pain. Kegels during this time can make you feel worse, not better. So, what should you do if you suspect you're in one of these groups? The answer is simple. Get evaluated. A qualified men's health urologist or pelvic floor physical therapist can help assess your situation and guide you safely. It might mean waiting a few weeks, or learning a modified version of the exercise, or focusing on release and relaxation first. Whatever the case, it's worth it, because doing this right is far more important than doing it fast. And here's the good news. Just because Kegels aren't right for you today doesn't mean they never will be. I've seen men return months later, stronger, healthier, and ready to start with the right foundation. It's never too late to begin again, but it's always too soon to ignore your body's signals. Now, if you've gotten this far and everything sounds like a green light, no pelvic pain, no recent surgery, no infection, then congratulations. You're likely a great candidate to start Kegels the right way, but there's still one more piece of the puzzle. Before we dive into any routine, you need to know exactly which muscle to activate. Miss this step, and all your effort could go to waste. So let me show you how to find the right muscle and how to test whether you're truly engaging it. What comes next might surprise you. 4. How to find the right muscles, your male Kegel zone. The biggest challenge for most men starting out with Kegel exercises isn't motivation, it's precision. It's knowing whether you're actually doing it right. Because unlike lifting weights or walking on a treadmill, you can't see the pelvic floor muscles move. There's no mirror, no burn in your arms, no sweat on your brow, and if you've spent 60, 70, or even 80 years never consciously engaging this part of your body, you're not alone. For many of the men I've worked with, finding the right muscle can feel like learning a new language, one spoken deep inside the body. Let me take you back a few years to a patient of mine named Walter. He was 73, recently retired, and had just undergone a prostate procedure. He came to me embarrassed about post-urination dribbling and felt like he had lost a part of himself. When I first explained how to find and engage his pelvic floor, he looked puzzled. "You're telling me I've got to squeeze something I didn't even know I had?" he asked. We both laughed, but that moment stuck with me. Because for many men, this discovery is the turning point, the moment they reconnect with a part of their body they'd never really paid attention to before. So, how do you find this elusive muscle? You start by imagining a situation every man can relate to. You're standing at a urinal and suddenly someone knocks on the door, or you hear a loud noise, and you need to stop the flow of urine instantly. That instinctive squeeze, that lift you feel somewhere deep in the base of your body, is the pelvic floor contracting. It's subtle, it's internal, but it's real. And if you can isolate that motion, even just for a moment, you're on the right path. For a more physical way to connect, I recommend sitting on a firm chair, scooting forward slightly so your genitals hang just off the edge. Take your index and middle finger and place them gently on the area between your scrotum and anus, the perineum. Breathe deeply. Relax. Now, try that same stop the pee motion. If you're doing it right, you'll feel a gentle lifting or tightening beneath your fingers. It might be slight. It might feel like a flicker, but that's it. That's your male Kegel zone. And here's where most men go wrong. They think more is better, so they clench their thighs, tighten their abs, even squeeze their glutes. But none of those are the target. In fact, using those surrounding muscles can create tension and even worsen symptoms. The goal is to isolate the pelvic floor, the muscle that supports your bladder and sexual function, and train it to engage cleanly without assistance. Some men find it helpful to use visualization. One cue I often suggest is to imagine gently lifting your scrotum upward or pulling your genitals slightly into your body without moving a finger. Another is imagining that you're holding in gas at a crowded event, not clenching your whole body, but gently sealing off the escape. These mental images work, especially when paired with breath. Always exhale first, then contract. The breath helps ground your focus and prevents you from tightening everything at once. If you're not sure whether you're getting it right, don't be discouraged. It's common for this to take some trial and error. And if you've ever done abdominal or lower back exercises, you know how long it can take to truly feel the deep muscles. But here's the good news. Once you feel it once, even briefly, you'll know. And from there, everything gets easier. Your awareness grows, and you begin building a connection that strengthens over time. Walter, the man I mentioned earlier, eventually found that connection. He told me one day, "I finally felt it, Doc. It was like flipping a switch inside." He stuck with the routine, and within weeks, he noticed the dribbling start to fade. Months later, he said he felt more confident just walking out the door, because he knew he had control again. That's what this is really about: dignity, assurance. and the quiet strength of knowing your body is working with you, not against you. Now that you've found the right muscle, or at least know where to look, it's time for the part most men are waiting for. How exactly do you train it? What routine should you follow? How many times a day? For how long? And what's the one mistake that could cancel out all your hard work? Let's answer all of that next. You're closer than you think. 5. Beginner Kegel routine for elderly men. Now that you've located the right muscle and begun building that connection with your body, it's time to take the next step, putting it into practice. And this is where things start to feel real. Because now we're not just talking about theory or anatomy, now we're training, now we're rebuilding strength. And let me be clear about something right from the start. This routine isn't about proving anything to anyone. It's about reclaiming something for yourself. Quietly, steadily, with patience and purpose. When I work with older men just starting their Kegel journey, I always say the same thing. Slow is strong. You don't need to rush. In fact, the best results come when you move with awareness, not intensity. Your goal is not to clench as hard as you can, it's to develop control. Think of it like learning to play the piano. At first, your fingers feel clumsy. You hit the wrong notes, but over time, with practice, your hands begin to move with confidence. This is no different. So, here's how I like to introduce the Kegel routine, especially for men in their 60s and older. Find a quiet place where you can sit comfortably. A firm chair works best. Sit tall, feet flat on the ground, with your back supported. Rest your hands gently on your knees. If it helps, you can place 2 fingers over your perineum, just like we discussed earlier. That tactile feedback is a great way to confirm that you're activating the right area. Start with a deep breath in through your nose, then exhale slowly through your mouth. Once your lungs are empty, gently contract your pelvic floor, like you're stopping the flow of urine or lightly lifting your scrotum upward. Hold that contraction for about 1 second, then fully release. Breathe in again. Breathe out. Repeat. That's 1 repetition. Simple, right? The key is not to hold it too long in the beginning. A light, controlled, flick on, flick off approach works best. Do 10 repetitions like this. Breathing in, breathing out, engaging, releasing. 10 times. That's your first set. I recommend doing this 3 times a day. Once in the morning, once in the afternoon, and once in the evening. Don't overthink it. Just choose a time that fits naturally into your day, maybe after breakfast, after lunch, and before bed. These little windows of practice create momentum, and momentum leads to results. Many men ask me, how will I know if it's working? And I always say, you'll know because your body will begin to speak to you in new ways. You might notice fewer bathroom trips at night, less post-pee dribbling. A stronger response when you're intimate with your partner. You might even begin to feel more grounded in your body, like you're walking taller. These changes are subtle at first, but they grow over time. I've seen men who could barely feel the contraction in week 1 develop full control by week 6. It's a slow build, but a powerful one. Let me share a moment I'll never forget. One of my patients, Harold, was 68 when he started. He'd just recovered from prostate surgery and was feeling discouraged. He had tried other exercises before, but gave up after a few weeks. This time, though, he committed. We kept it simple, just 10 reps, 3 times a day. At his 2-month follow-up, he said something I'll always remember. He said, "Doc, I don't feel broken anymore." That's the kind of shift we're aiming for. Not just physical improvement, but emotional restoration. That sense of quiet confidence that comes from taking your health into your own hands. And just like any workout, consistency is everything. Missing a day here and there won't ruin your progress, but the men who see real results are the ones who keep showing up. Make it a habit. Attach it to something you already do, like brushing your teeth or watching the evening news. Before long, it'll become part of your routine, something you look forward to, not because it's exciting, but because it works. But as important as it is to do the exercise, it's equally important to do it the right way. And that brings us to one of the biggest obstacles men face with Kegels, the mistakes that sabotage their progress without them even realizing it. So before you dive in too deep, let's talk about the most common errors men make and how you can avoid them from day one. Because if you're going to do this, let's make sure every rep counts. 6. Biggest mistake most men make plus how to progress. By now, you've come a long way. You understand what the pelvic floor is, why it matters, and how to begin strengthening it. But before you get too comfortable, I need to tell you something important, something I've learned the hard way, both through research and from listening to countless men in my practice. The number one reason Kegel exercises fail isn't because they don't work. It's because most men are unknowingly doing them wrong. I've seen it over and over. A man comes in, hopeful, maybe even excited. He's been doing Kegels for a few weeks, maybe even months, but isn't seeing the results he expected. No better control, no change in performance. And then, when I ask him to show me what he's been doing, or walk me through how he practices, it becomes clear within minutes. He's either clenching the wrong muscles, holding the contraction too long, or turning the exercise into something it was never meant to be, a full-body strain session. Let me explain. Your pelvic floor is part of your core, yes, but it's subtle. It doesn't respond well to brute force. If you're squeezing your abs, tightening your thighs, or clenching your glutes, you're missing the point. The goal of Kegels is precision, not pressure. The contraction should feel like a gentle lift inside your body, not a tightening of your entire lower half. It's quiet, focused, controlled. Another mistake I see often is men trying to max out from the start, holding each contraction for 10 or even 20 seconds, thinking more time equals more results. But that's like trying to run a marathon before you've learned how to jog. When you overwork a muscle that's already weak or untrained, you create tension, not strength. This can lead to fatigue, frustration, and even setbacks. So here's my guidance. Start small and progress slowly. Begin with 1-second contractions, just a flick on, flick off movement. Once you can do 10 of those consistently, 3 times a day, without recruiting other muscle groups, then, and only then, should you increase the hold time. Move to 2 seconds, then 3. Eventually, you can work your way up to 10-second holds with full control. But don't rush it. The body responds to consistency more than intensity, especially as we age. A helpful way to check your form is to place your hand on your stomach during the exercise. If your belly is moving or tensing up, you're likely engaging your abs. Try again, but this time, focus on keeping the rest of your body relaxed. The only movement should be internal, a lift and a release. Let me tell you about Frank. He was 72, a retired electrician, and one of the most determined men I've ever met. He came to me after trying Kegels on his own for 4 months with no improvement. We did a quick assessment and discovered he was holding his breath every time he contracted, turning the exercise into a kind of internal strain. We made one change, pairing each contraction with an exhale, and within 3 weeks, he began noticing results. That one adjustment made all the difference. Sometimes it's not about working harder, it's about working smarter. And as your strength improves, you can start changing positions. Begin lying down, then move to sitting. Once you've mastered it there, try doing your Kegels while standing. Each new posture adds a level of challenge, training your pelvic floor to function under different conditions, just like it would in real life. You can also begin integrating Kegels into your day. I tell many of my patients to associate them with habits, waiting at a red light, brushing your teeth, watching the evening news. These micro moments are opportunities to build strength without needing extra time or privacy. That's when you know the habit has truly taken root, when it becomes a part of how you live, not just something you do. The journey with Kegels isn't always a straight line. There will be days when you forget, when you question if it's working, when you feel discouraged. That's normal. What matters most is that you return to it, that you trust the process. Because I promise you, when done correctly and consistently, Kegels can offer real change. Physical change, yes, but also emotional. The kind that makes you feel steady in your skin again. So now that you've learned the biggest mistake to avoid and how to progress with purpose, it's time to zoom out and look at the big picture. What does all this mean for your quality of life? What changes can you expect? And how can you stay committed even when progress feels slow? Let's bring it all together as we wrap up. And I think you'll be surprised at just how much power you still hold. Conclusion. If you've made it this far, I want to say something from the heart. I'm proud of you. Most men don't take the time to learn about their health, let alone take action, especially when it comes to something as personal and private as sexual function and bladder control. But what you've learned here isn't just information, it's a roadmap. You now know what Kegels are, the science behind them, who they're right for and when to wait, how to find the right muscles, how to train them safely, and how to avoid the most common mistakes that hold men back. More importantly, you've taken the first step toward reclaiming strength, confidence, and control in a part of life that still matters deeply, no matter your age. I've seen too many men give up too soon, but I've also seen what's possible when you stay consistent. This isn't just about exercises, it's about feeling like yourself again. Capable, grounded, connected. Your age doesn't define your vitality. Your effort does. So keep going, trust your body, and remember, you're not alone on this journey.